Hello, everyone. Good evening, good afternoon, good morning, wherever you are. It's nice to have everyone here. Onyi Jennifer, you're welcome. How was your day, or how is your day going, wherever you are? Uh, Gold Diva, you're welcome. It's nice to have you here. I just want to give us a little bit of time for people to join, then we start. Pending that time, the topic of this good evening, Gold Diva. How are you? So the topic of today's Instagram live is the importance of knowing the cause of infertility before you take medications. So I am. Let me introduce myself first before we start. So I am Dr. Shay, and I'm a consultant gynecologist, and also I'm a fertility expert. I've been practicing this um, in this um, specialty for more than 12 years. And over the time, I've seen that one of the major issues with women that are trying to conceive or women that are pregnant, one of the major issues, Okoyemi, you are welcome. Colette, you are welcome. One of the major issues is that a lot of couples or a lot of women, they don't have the right information. And when you don't have the right information, Shepuya, good evening, you are welcome. So when you don't have the right information, you will likely you likely suffer, you likely waste time, you likely waste energy, you waste resources, you waste finances, you waste a lot of things. So, um, and I found that if I can put out information for people, I think I will solve more than 50% of the problem. Good evening, Colette. So that was why I started using online media, Instagram, Facebook, Twitter, to give out information. And I've been doing that for about 5 years now. And this topic came about because of the interaction I've had online and physical with people. I would just, when I meet some patient or client, Folakemi, you are welcome. Ladies, Jean, or you are welcome. So when I meet some clients, I also get you are welcome. And we start talking. They tell me that they have been on some medications. Um, the major culprit is clomid. A lot of women use clomid. Adenike, you are welcome. A lot of women use clomid. And when I ask who placed you on clomid, and they will say, no, maybe a friend of theirs used clomid and she got pregnant, or a medical personnel asked them to start using clomid. So when I ask, were you evaluated? Did you do any tests before you started using these drugs? They will say no. That my friend got pregnant when she used clomid, so I felt I too can get pregnant if I use clomid. And in most cases, it doesn't work. It doesn't work in most cases. While in some cases, some are actually, especially for those that their problem will be solved by clomid, it will work for them. But in majority of cases, it doesn't work. So that was where I decided to talk about this issue of having proper evaluation before you get pregnant. Before you start taking medications. Lizzie Toyo, Ade, Ewa Sexy, Umi 500, you are all welcome. So that was why I decided to come and discuss this topic so that people can know that you shouldn't just start using medications if you have not been properly evaluated, especially when you are trying to conceive or even when you are pregnant. There are some medications you don't just use without your doctor telling you, okay, this is what you should do. But most especially when you are trying to conceive, you should not use medications without proper evaluation. So, by the way of introduction, infertility, which is the reason why we are here, is when you have a man and a wife, or a man and a woman, when they have been having regular sexual intercourse of at least 3 times a week, that is well spaced, um, for a period of a year, in a woman that is less than 45, 35 years, or 6 months in a woman that is 35 years and above. So if you have a couple that have been together for 1 year, if the woman is less than 35 years, or 6 months if the woman is 35 years and above, and they have been having regular sexual intercourse. I said regular, 3 times a week, Monday, Wednesday, Friday, thereabouts, leaving a day in between. If they have had it for that period of time and they are not conceiving, it's difficult to conceive or get pregnant, then those couples can say they have problem conceiving. They can say, okay, we are having infertility issue. If you have not fulfilled those criteria, then you are just wasting time. You have not started. So, what are the criteria that a woman, that must be fulfilled before couples can get pregnant? One, the sperm of the husband or the man. The sperm must be adequate, adequate in count, must be good when it comes to the status of the sperm. When it comes to the movement, the sperm must be able to move forward and fast. Must be alive. Well, it has to be alive before it can move. But there are some sperms that are alive, but they are moving in circular fashion, or they are just staying in one. They are just staying on one spot, and they are not just their tail moving. So in such instance, if the man does not have adequate sperm in terms of number, the sperms are not moving well, then most of the sperms are not alive. That kind of a man may not be able to impregnate a woman. That is one criteria that must be fulfilled. The other criteria is that, or criterion is that the woman must ovulate regularly. Ovulation means that um, the woman is growing eggs and releasing the eggs, and it must be regular. It must be every month. So the woman must ovulate regularly. Then the tube of that woman, the fallopian tube, is very important if you will get pregnant naturally, because the fallopian tube is where the egg and sperm meet. So that means the tube must be open, must be functional. There are a lot of women with unfunctional or non-functioning tube. When your tubes are blocked or they are not functional, there is no way you can get pregnant naturally. So that is another criterion that must be fulfilled. The other criterion is that um, the womb of that woman must be receptive to pregnancy. You can get pregnant. The egg can be fertilized, and there is problem with implantation of the embryo. It's just like when you have a farm. This is a logic or analogy I use regularly. If you have a farm and you want to plant maize, and you have rocks, it's a rocky land. You have problem growing the maize because of the rocks. The maize will not likely germinate. And so those are the um, four criteria. The sperm must be fine, must be ovulating well. The tubes must be okay, and also the uterus, which is the womb, must be receptive. So these are the criteria that must be fulfilled. So there are different reasons why couples will not get pregnant. It could be due to the problem with the man. It could be due to problem with the woman. It could be due to a problem with both of them. And sometimes it can be unexplained. So From everything I've said, these are the things that evaluation will look at. The evaluation will look at, okay, where are the problems? So if you are just using medications without properly being evaluated, that means you may just be firing blanks. So why do you need to have something to be evaluated before you use medication? Why do you need to be evaluated? One major reason for that is it's not every issue, it's not every case that needs medication. Sometimes I've found couples that for about 3 years they've been trying to get pregnant, but they couldn't. And when I asked them questions, I found out that they were not having sex regularly. They have sex maybe once in 2 weeks. They have sex maybe once a month. So if you are not having adequate number of sex, regular sexual intercourse, the likelihood of getting pregnant is very low, except if you are just lucky to have had sex when you ovulate. So when you ovulate and you have sex, the likelihood of getting pregnant is there. But if you are not having sex regularly, like I said, you must have at least 3 times a week before you can say that you have not been able to get pregnant. So you may not actually even need medication. Fine, you need supplements. I'm not talking about supplements. You need folic acid, you need vitamins, you need zinc and all sort of supplements. But I'm not talking about supplements. I'm talking about medications that are used in treating infertility cases. So it is not every time that your issue or the issue with those couples need or require medication. All you may need to do is to plan when you have sexual intercourse. Maybe plan the time to when you have during your fertile period, or have regular sexual intercourse every week. There are a lot of couples that these have helped, because when I interact with them, I say, "Oh, you have not been having sex as you should. So for the next 4 months, let's try this aspect. Let's try this. I will teach them their fertile period. Okay, go and do this for 4 months." And within 4 months, a lot of them, majority of them will get pregnant. So that means it's not everybody that require medication. Sometimes it may even be surgery that you need. Let's say you have fibroid. Like I said, that if you are planting maize on rocky ground, on rocky land, it may not work. So it's the same thing with some cases like fibroids in the womb. If the fibroid is staying where the embryo is supposed to implant, the embryo, even if it implants, may be having recurrent miscarriages. I've had clients that it was until after we removed the fibroids that they got pregnant, or until after we removed the fibroid that their pregnancy stayed. They were able to carry the pregnancy to term, and they were able to have their baby. So it may not be every time that you need medication, and that is why you need to be evaluated. So don't just start using drugs. Well, my friend used Clomid, I too will use Clomid. It doesn't go that way. Another reason is that sometimes there are some conditions that pregnancy aggravates. Pregnancy will lead to death or severe morbidity in that woman. There have been cases of women that lost their lives while pregnant. They have been trying to conceive, and when they conceived, they now started having a problem that they didn't even know that they had before. There are some heart conditions that once you get pregnant, those heart conditions and pregnancy don't go together. So if such a person that should have been evaluated well before getting pregnant did not get evaluation and she gets pregnant, the likelihood that she may die is high. And that is why it is important that you should be evaluated. Conditions like hypertension, like diabetes, heart problems, these are evaluations that you must have. Rule out all these problems before you even think about getting pregnant. So it's not that I want to get pregnant, I start using medication. I've been trying to get pregnant, I've not gotten pregnant, all this while. I don't need any doctor to talk to me, I don't need to see any specialist. My friend used Clomid, someone used Letrozole, and they got pregnant. I too will use. A lot of people have died, or they have been severely um, they've had severe morbidity just for using medications they are not supposed to use, or for getting pregnant without even proper evaluation. And sometimes it is not all conditions that you need the same medication for. That's another reason why you should be evaluated. You will see that there is, as I talked about the reason, I talked about one of the criteria for getting pregnant. I said you must have regular ovulation. Now, there are different reasons why a woman may not ovulate. One of them may be polycystic ovarian syndrome, PCOS. Another may be hyperprolactinemia, when you have milk, hyperprolactinemia with galactoria, when you have milk coming out from your breast. This one can also affect ovulation. Another can be thyroid problem. Another can be just your weight that is not allowing you to get pregnant, or that is not allowing you to ovulate. So, using medications, there are different kinds of medication we use in all these instances. For PCOS, the medication we use is different from the one we use for hyperprolactinemia, which is different from the one that we use for thyroid problems. So, just using any medication without even knowing what your problem is just a waste of time. And all these drugs, all these medications, they are not even the kind of medication that you use for a long period. You have to use them um, in a focused manner. You have to use them, you have to have an intent, a reason why you are using them, and it has to be limited. It's not that you now be using it for 2 years. You use clomid for 2 years. You are going to expose yourself to cancer later because you have overstimulated your ovaries. You can have ovarian cancer if you are not careful. So that's why it's very important that you must be evaluated before you think about using any medication. And sometimes another reason may be that it may not even be the woman that has the problem. It may be that it's the husband or the partner. I've had series of clients that they were using medications to ovulate, and they've used it. They will even go for tests that will show that they are growing eggs and they are releasing the eggs, but they are not getting pregnant. And when we now evaluate both the husband and the wife, we now find out that it's actually the husband that had issues. And so there is no way, because the sperm that should fertilize the egg, they are not there. They are not. Is either they are dead. Majority of them are dead, or majority of them are not even moving forward or fast enough, or the count is not even adequate, and the woman is using drug. So if you are using drug without even knowing if the husband is even fine, if the partner is okay, then it's just a waste of time. It's a waste of money. It's a waste of resources. So this is another reason why it is important for you to be evaluated before you start using medication. There are sometimes that it may not even be the kind of medication that you are using that you need. It may be that you need another option, or you need other options. Like if you have blocked tubes now and you are using clomid, you are just wasting your time. Because as long as you have a blocked tube, there is no way the sperm can meet your egg. So if you have been told that you have blocked tubes and you are using clomid, it's just a waste of time. Naturally, it is not. It's going to be very difficult. There's nothing impossible anyway, but it's going to be very difficult for you to be able to conceive naturally if you are having blocked tubes. In that instance, your option is going to be, or should be, um, IVF. Because what IVF would do is to take your egg, bring it out of your body, take the sperm, and join it together in the lab. And once we join them together, we take the embryo, the baby that is formed, we introduce through the vagina into the womb. And we allow and we watch for it to to implant, and the pregnancy continues. A lot of people have been able to get pregnant just through IVF. So if you are using medications, you are using clomid, you are using all those other drugs, when your tubes are already blocked, there is a waste of time. So that is why you need to have been evaluated before you start. You don't start using medications without knowing why you are using the medication. You can't just use drugs or medications without knowing. So how do you get evaluated? I'll soon round up. So I'll just, if you have any question, you can post the question so that I can answer the question once I round up. It's not going to be a long um, live program. So how do you get evaluated? How? One of the major ways we evaluate, there are three different ways. One is talking together. We call it history taking. There are questions we ask. If you have had an online consultation with me, you know that there are a list of questions, about 21 of them, if not more, that you will answer. We'll send the list of questions to you. Okay, when we see those answers, we know, okay, what else? From the answers, we ask different questions again to know what the issues are, to know where the problems are. Then from there, if it's a physical consultation, a form of examination may be performed. Check you generally, check if you are having milk from your breast, check your tummy to see if you have um, um, mass in your tummy, ruling out fibroids and other problems from the womb. Sometimes you can do a vaginal examination just to check you and see if there are issues. Then we now go to tests. It is the test that will now let us know from what we are suspecting, from the history that we have taken from you, the examination. We now say, okay, let's do test. And the criteria that I listed, the sperm that must be adequate or the sperm that must be fine, ovulation, the tubes, the womb. These are the tests we will now do to find out that are those criteria, are they met, or is there any one of them that you are having issues between you and your partner? Is the sperm fine? Are your tubes okay? Are you ovulating? Then is your womb fine? These are the tests that we carry out to find out, okay. Then if you have medical conditions, we can check other things. Okay, can you cope with pregnancy? Okay, if you want to give you some medications, what are the things we need to put in place? That is why it is very important for you to be evaluated. Those are the ways you get evaluated. So you don't just start using medications without knowing the reason why you need to use medication. It is very, very important. So by and large, if you have any question, you can send them because I'll soon round up. So, like I said, the reason why you must be evaluated before you use medications. One, it is not every condition that requires medication. Some may just require timing, regular timing of your sexual intercourse. Some may require surgery. Some, it may be that it's the husband that or the partner that even has the problem that needs to be taken care of. The sperm are bad. So the sperms are bad. So that one we need to take care of. So the woman using medication is a waste of time. It may be that you need another different kind of medication to sort out the problem. And it may be that you need other options, IUI, IVF, for you to know, okay, what do I do? So by and large, you need to be evaluated first before you go to start medication, before you start any process of getting pregnant. It is very, very important. And I need people to start taking, you should tell your friends. The fact that somebody used Clomid and it worked for her doesn't mean that you will use Clomid and it worked for you, because what caused the problem for that person may not be what is the problem with you. And that is why it is important that you check yourself first. You check your husband first. In fact, a couple, they need to attend the clinic. So if you can attend it together, attend it on different occasions. But make sure at least you do your test. The sperm test is important. The woman also is tested. We check if you are ovulating, if your hormones are fine. We check everything, check your tubes. Then we can now say, okay, this is where we go. All right, any question? I hope, sorry, I didn't even ask if people are following me. I hope you guys got from the discussion. Do you have any question? Bolinto, sorry, you are welcome, though we are almost rounding up. Mayo, how are you? It's been a while. How is everything? Maria Yomi, the happy child, you are all welcome. Chichin Wokolo, you are welcome. Do you have any question? Funke, you are welcome. I'm about rounding off. You can check the, if you need to have a one-on-one consultation with me, you can send a DM through the Instagram. Send a message to me. Online consultation, you can send a WhatsApp message to 08066275937. Then you can have your online consultation. Or you can, if you want to see me physically, if you are in Lagos, you can also send a DM. We can tell you the locations where you can see me, and from there we can move forward. There are a lot of people I've not even seen before that are pregnant now, and it's through online consultation that they got pregnant. All right. If there is no question, I think we can round off now. All right. Till another time. Stay blessed. Bye bye.